Think about the sheer volume of supplies it takes to run just one single hospital for a single day. Now multiply that by every clinic, pharmacy, and medical facility across the globe. We are talking about literal mountains of medical packaging, cardboard boxes, and honestly tons of unused or expired drugs moving through the supply chain every single day. It's an absolute logistical marvel, but it creates a staggering environmental footprint. So how do we actually fix it? Well, welcome to today's Explainer, where we're unpacking exactly how the healthcare distribution industry is held accountable for all this material. And hey, this isn't just about vague green initiatives or, good PR. We are diving into the strict, rigorous accounting standards that force companies to prove exactly how sustainable they actually are. Why should you care? Because ultimately, supply chain waste affects the prices we all pay for healthcare, not to mention the actual environmental damage we all have to live with. So here's our roadmap for this Explainer. 1. The SASB healthcare standard. 2. Focusing on product life cycles. 3. Strategies for packaging reduction. 4. Tracking metric tons. And 5. The future of sustainable healthcare.
All right, kicking things off with Section 1, the SASB healthcare standard, establishing credibility.
To really grasp what's going on, you've got to know the rule book. We're talking about the SASB standards. Now I know they're under the stewardship of the ISSB and part of the IFRS Foundation. It sounds like a whole lot of corporate alphabet soup, right? But honestly, this is the globally recognized framework that actually holds companies accountable. It requires entities to disclose sustainability-related risks and opportunities that could legitimately affect a company's cash flows and cost of capital. They are effectively treating sustainability data with the exact same gravity as hard financial data.
Moving right along to Section 2, focusing on product life cycles, from broad standards to specific action. When you look at the SASB industry standard, distributors have a lot on their plate. They have to report on some heavy-hitting topics, everything from fleet fuel management, how much gas their delivery trucks are burning, to super sensitive areas like counterfeit drugs and product safety. But nestled right there in the middle, that's product lifecycle management. This is the category that demands distributors actually take responsibility for the physical footprint of what they sell, all the way from the box it ships in to the absolute end of the product's usable life.
It really boils down to a classic 1-2 punch. The standard breaks this lifecycle management into two totally distinct reporting codes. On one hand, you've got HCDI 410A.1, which is all about discussion and analysis, basically saying, first, tell us what your qualitative strategy is for handling packaging. On the exact opposite side, you have HCDI 410A.2, which demands cold, hard, quantitative data on product take-back, meaning, okay, now prove it with the data. Which brings us to Section 3, Strategies for Packaging Reduction, the Qualitative Approach. Now, before a company can even talk about reducing packaging, they have to define exactly what kind of packaging they mean. So we anchor ourselves in 3 strict definitions here. First, primary packaging. This is what directly touches the product. Think of the blister pack holding a pill, or maybe a sterile pouch for a syringe. Then there's secondary packaging, which holds that primary package along with protective materials, like that branded cardboard box you grabbed right off the pharmacy shelf. Finally, tertiary packaging. This is also known as transport packaging. It's the heavy-duty stuff: pallets, shrink wrap, those massive shipping crates. Distributors actually have to disclose their degree of control over all 3 of these levels. Once they've nailed down what they actually control, distributors have to detail their specific efforts to cut down on waste. So what are the expected go-to strategies? Well, 2 massive ones are dematerialization and reusable containers. Dematerialization is essentially the holy grail of sustainability. It means doing more with less, designing systems that fundamentally require less physical material to exist in the first place. And shipping products in reusable containers, that means finally moving away from single-use cardboard to durable, returnable totes that get used hundreds of times across the supply chain. Distributors can also talk about using recycled content, certified paper, and consolidating shipments just to use fewer boxes overall.
But here's the kicker. Even within this so-called qualitative discussion section, the standard basically says, okay, prove it. Companies are highly encouraged to back up their claims with actual performance measures. They're asked to provide percentage reductions in packaging weight. If they're bragging about those reusable containers we just talked about, they can't just say they use them, they have to report the container reuse frequency. Literally, how many trips does a single container make before it becomes trash itself? They can also report the ratio of packaging to product weight, which flat out proves if they are actually achieving that dematerialization goal.
All right, let's pivot to Section 4, tracking metric tons, the quantitative take-back tally.
Metric tons.
That is the exact required unit of measure for this part of the standard. When a distributor accepts products back from hospitals or pharmacies, whether it's an overstock of supplies, outdated equipment, or unused medications, they can't just throw around vague terms like several truckloads or thousands of items. No way. They must quantify the exact amount by weight, in metric tons. This completely standardizes the data across the entire global industry, which lets analysts and investors finally compare apples to apples.
And what exactly are they weighing? The standard is incredibly clear here. This tally specifically applies to the end-of-life management of actual medical goods. The official text says, quote, "The scope of the disclosure shall include drugs and medical devices and supplies." So we are definitely not talking about recycling office paper from their corporate headquarters here. We're talking about the core products they distribute. An entity can even choose to break this data down further, disclosing the weight of drugs entirely separately from the weight of medical devices and supplies.
The standard actually hands them a literal formula to calculate this take-back number. To get that final metric tonnage, a distributor just adds together 3 specific buckets. Step 1, the weight of material reused, which includes refurbished medical devices that get cleaned up, fixed, and put right back into service. Step 2, the weight of material that is recycled or remanufactured through processing. And step 3, the weight of material that is safely donated. Add those 3 weights together, and boom, you get the total metric tons of products accepted for take-back.
But listen, this might just be the most crucial rule in the entire standard. Any items discarded as waste are strictly excluded from this calculation. Period. So let's say a distributor takes back 10 metric tons of expired drugs, but because of safety regulations, they can't be reused or recycled and have to be incinerated or thrown into landfill. Those 10 tons absolutely do not count towards their take-back metric. This ensures companies cannot artificially inflate their sustainability metrics just by acting as a really expensive garbage collection service. Only products that are actually diverted from the waste stream can be celebrated here.
Let's wrap things up with Section 5, the future of sustainable healthcare, beyond the metrics.
Mandating these exact metrics for dematerialization, packaging to weight ratios, and metric tons of product take-back, it proves something massive. The fact that SASB is now integrated into the IFRS Foundation shows that sustainability is no longer just a cute PR move. It is a fundamental pillar of corporate accounting. The entities funding these multi-billion-dollar healthcare distributors now view environmental risk, resource scarcity, and supply chain inefficiency as actual, literal financial risks. Simply put, if a distributor is wasting material, they are wasting money, and they are now required to expose that inefficiency on a global stage.
So I'm going to leave you to ponder this final thought. We've seen how meticulously these standards force companies to categorize their packaging and literally weigh out their reused medical supplies. But as these disclosures become the absolute norm across the industry, will the act of reporting the data alone force the healthcare supply chain to truly cure its waste problem? Or is simply weighing the metric tons of our medical footprint just the very first step in a much longer journey toward a sustainable future? Thanks for joining me on this explainer, and keep asking the hard questions.